Hi, welcome everyone. So navigate between my screens. And so welcome to our second webinar of a 4-webinar series. We'd like to acknowledge the traditional custodians of the land on which we meet. For me, this is the Darug people. We pay our respects to elders past and present and acknowledge the Aboriginal people for their custodianship of this land. So today's webinar is specifically addressing emotional wellbeing in the postnatal period. My name is Katrina Shade. I'm the team leader for the Western Sydney Local Health District Perinatal Infant Mental Health Service. We have a wonderful expert panel with us in our virtual background. So Dr. Lara Hawari is a perinatal child and adolescent psychiatrist. Chris Barnes, perinatal psychologist and clinical team leader, Gidget Foundation Australia, and Melissa Russell is a clinical nurse consultant from Child and Family Health. A few key points to start with. So this webinar is being recorded. The information being presented today is designed for general public education and is generalised. We acknowledge that everyone's experiences and circumstances are unique. We ask you to think about this information for yourself and in relation to your friends and family that may be parenting a new baby or infant. With the whole webinar series, we hope to reduce the stigma of mental health challenges and encourage people to talk about mental health and feel okay to speak up. We want to reduce shame associated with mental health challenges, disorders, and illnesses. So please feel welcome to take photos of the slides. We actually really encourage you to do that. And we have enabled the chat function in this Zoom session for you to ask questions, place comments for the panel. Only the panel will see your questions or comments and will address the main themes that come forward towards the end of the webinar. If we have any healthcare workers attending, please feel welcome to post your comments about your experience and we'll try and share. If any of the presentation has raises some concerns for you, we encourage you to seek support. At the end of the presentation, we'll have slides of various resources where support can be accessed. So I'm going to hand over to Chris Barnes now to introduce our partners in the webinar series, Gidget Foundation Australia. Chris?
Hi, everyone. So we have Melissa, Melissa, do you want to introduce yourself and say a little bit about you? Because you're one of our wonderful panelists today.
Sure. Hi, everyone. My name is Melissa Russell. I'm a child and family health nurse, clinical nurse consultant with a portfolio of perinatal mental health, working across the site in Western Sydney, LHD. Thank you. Chris.
Thank you. So Melissa, we also have one of our lovely Gidget angels, Kathy, talking today about her experience of perinatal anxiety, depression a little bit later. So we're looking forward to hearing her story after I talk a little bit more in general about what can happen in the perinatal period as well. And then obviously Katrina, who you've already just met, she's going to take us through some sort of normal sort of things to expect in pregnancy. And then we'll get into some of the other more complex things that can happen after you have your baby. So I just wanted to start with what is Gidget Foundation Australia. So as you can see this beautiful picture of Gidget, this is a lovely young Sydney mum whose name was Louise and had a nickname Gidget, and she took her own life due to unrecognised postnatal depression 20 years ago now. And in her honour, this foundation was set up to make sure that that same thing doesn't happen again to other women in that postnatal period. So if we go on to the next slide, Katrina, we have various services that we have developed to support new mums and new dads, and also expectant parents as well, or people going through IVF or have had some sort of neonatal loss. So we offer counselling is sort of like the mainstay of our services. We have face-to-face counselling services, and we also have a telehealth program for our more rural and remote clients. It's an Australia-wide service and it's free. So we offer between 10 and 20 counselling sessions usually for people, and you'll need a GP referral and a mental health care plan to access those services. Other sort of programs that we have an emotional wellbeing program in some of the hospitals around Australia as well. And we also have a Gidget Village, which is a treatment program, a group treatment program, which is wonderful. And then we have some online Facebook groups that you guys can join. It's called the Gidget Virtual Village for dads. And then we have a Gidget Virtual Village for mums. And it's a really lovely peer support group. It is moderated by some of our staff as well. Lots of lovely support and comments for everybody, from like, oh, I had a terrible night feeding last night, to does anybody have any ideas about how to feel a bit better today? So it's a really lovely support. And just to sort of let you know, in the last year, we have performed about 11,000 consultations in more than about 17 offices and our Start Talking program together. So we've been very busy. As you can imagine, and with COVID as well, making it even more demand for counselling services. Now, I think I'll go back to Katrina now.
Yep, struggled to find my mute and unmute button. Thanks, Chris. All right, so emotional changes that affect parents. Pregnancy and early parenting are powerful and life-changing experiences for all parents and families. These changes can stir up some strong, deep, and unexpected emotions. Partners, there might be times when you feel flat, down, or irritable. These kinds of changes are common in fathers and all non-birthing parents during early parenting. Emotional changes that last longer than 2 weeks and get in the way of daily life could be depression. Depression during pregnancy is called antenatal depression. Depression after birth is postnatal depression. Similar symptoms, same symptoms, treated similarly. It's just the timing that's different. You might hear these conditions referred to together as perinatal depression. And anxiety often presents comorbidly with depression, but can also present on its own. Adjusting to parenting. So during your baby's first few weeks, you'll spend most of your time feeding, cleaning, dressing, and comforting your baby. You may feel overwhelmed. It's normal to feel like you don't know what you're doing, especially if this is your first child. And it can be difficult to admit to yourself that you're struggling, and even harder to tell someone else. However, there's often an enormous sense of relief that comes with sharing. Some normal physical changes include breast enlargement and discomfort due to hormonal shifts. This is whether you choose to breastfeed or not. Pelvic floor changes that could mean incontinence, the stomach pouch, stretch marks, varicose veins, extremity swelling, night sweats, hair loss, skin discoloration, and postpartum vaginal changes. If you've had a cesarean, it's a major surgery. It's a painful and recovery that can last for up to 6 weeks or even more. A large blood loss during the delivery can result in low iron and increased fatigue. And whether it's a vaginal birth or cesarean section, both are exhausting on the human body, and recovery time is required. So hormone level shifts, along with brain changes associated with the birth and early parenting, can result in significant changes to normal habits. So hyper-alertness as a virtue of your new role of parenting a newborn can lead to a type of sleep disturbance known as psychophysiological insomnia. And this might look like light sleep, easy awakening, and difficulty falling back to sleep after your baby's back in the bassinet. You might also find yourself waking up every half hour to check on your baby, and that might exacerbate sleep disturbances further. Sometimes feeling tired can be also related to underlying medical conditions. Some psychological changes may include identity changes, career considerations, reflecting on your own childhood, additional worries or stresses such as COVID-19, And your experience of birth may have been perceived as traumatic, and we're going to talk a little bit more about this later. There may be some social life changes, including relationship changes with your partner, friends, family, or others. There's a redirection to activities and friendships that are more relatable to your new life situation. Parenting. So relationship changes are both emotional and physical. The dyadic relation becomes a triad or more if you have twins or triplets, or another addition to the family. And sleep deprivation can place extra strain on relationships, as sleep deprivation reduces our tolerance levels. There's adjustment to new roles and expectations within the relationship, and healthy communication is so important at this time. Spiritually and philosophically, parenting is a time of reflection on our beliefs, values, and what parenting might look like for you. In the context of these, we acknowledge real challenges and adjustment for everyone. However, these changes may contribute to a decline in a sense of self and mental well-being. So we're going to go over to Chris and to talk about baby blues.
Thanks, Katrina. So look, baby blues is incredibly common. Giving birth is probably one of the most dramatic transformational experiences that you will go through. There's many hormonal shifts, it's very exhausting, and just sort of that adjustment to parenting and a bit of that feeling of overwhelm in the very early days. Many women do get it. I think it's up to about 80% do that in the first few days or weeks. And it generally eases with a bit of extra support and reassurance. So, but the sort of things that you can find yourself being is a bit more teary, a bit more moody, maybe a bit more cranky and feeling overwhelmed and a bit more emotionally reactive. But it really does sort of does heal and it's very common. But I guess the distinction, a good distinction to make is between the baby blues and then maybe when some more sort of depressive symptoms are sort of showing a little bit more. So the baby blues will last for less than 10 days. And with depression, we sort of diagnose that if you get this, we'll go through later some more of the specific symptoms, but they need to sort of last for most of the day for at least 2 weeks. So the onset or when the baby blues start would be within 2 or 3 days postpartum. And then with depression, it can start within the first month, but it could be any time within that first year after you've had the baby. So as I said before, 80% get the baby blues, 10 to 15% get postpartum depression. And I guess it goes up to about 20% if we add in depression and anxiety, perinatal depression and anxiety as well. The sort of severity of baby blues, it's really mild. And with depression, I think it can be mild, but it sort of might go towards moderate or severe in terms of how it affects your daily life. There's no thoughts of suicide or self-harm with baby blues, and it may be present if you get more of the depressive symptoms, a bit more on the severe end. So who is more at risk? We know, and research and experience shows that there are some people who are more at risk of getting perinatal anxiety depression. So that's during the pregnancy period and up to 1 year afterwards, the term perinatal. These factors have been identified. So if you've had a previous experience of PNTA, depression, anxiety, past experiences in your history, recent stressful life events, maybe you've had another loss or recurrent miscarriages or some sort of loss, or even moving house, like something pretty significant that you found stressful. If you've got inadequate social supports around you, some sort of relationship issues, maybe with your partner, a past birth trauma or a recent birth trauma, and other sort of trauma history. So we also know, as well as risks, there are protective factors. And I guess I just wanted to add that, you know, people who do have more support around them, who are maybe able to access their coping skills, who are a little bit more resilient, and who are help seeking and able to have resources around them. So it's not all gloom and doom, because a lot of us might be able to relate to some of the risk factors, but there's a bit of a balance with other things that maybe you can do or add to in your life to sort of help you get through this time postpartum. So the sort of depressive symptoms that we find most commonly in men and women postpartum are feeling sad, low mood, crying for no particular reason, that real exhaustion, but a lot of women feel that after having their babies, but it sort of doesn't even dissipate even if you're getting a bit more rest. Difficulties sleeping, difficulties with appetite, not feeling like you want to hang out with people, quite irritable, a lot of memory and focus and concentration issues, and you really just don't find that joy in things that you would normally enjoy. Losing interest in sort of intimacy, and sometimes thoughts of self-harm, death or suicide as well. So they sort of have to be around for 2 weeks, pretty much most of the day, to get that sort of picture. So how do I know if it's just a bad day? Look, all new parents, all of us, even who are older parents, we all have bad days. So I think it's pretty normal. So I think it's just working out if you're having more bad days than good. I think that's some sort of indicator. And if those symptoms last for more than 2 weeks, maybe someone says to you, you may not even know that yourself. If someone says to you, you know, hey, you're not sort of feel like coming out as much with us. Are you okay? Sometimes it's other people that notice those things rather than yourself. But if you can realize that you're sort of not attending to daily routines, or you don't feel like interacting with your baby or other people around you, or you're becoming more irritable or angry on a more regular basis, or any thoughts of harm to yourself or others, that's the time to really seek help immediately. So then we're moving on to anxiety. So often these two things, like Katrina said, will happen together. There'll be a bit of anxiety and a bit of depression. One might be stronger than the other, but they generally happen together. So anxiety symptoms, like people may not know that these are actually symptoms. So they're good to sort of to educate yourself about. You might have a sense of impending doom. You might have hot and cold flushes. A lot of people get very physical responses with anxiety, like sweating and sweaty palms, or upset tummies, headaches, those sort of things. Feeling restless, very sort of agitated. Or you can have more sort of cognitive issues with anxiety, like lots of racing thoughts, negative thoughts about the world, that sort of thing as well, and having a hard time concentrating, or what we call obsessive or catastrophic thinking. Like obsessive thinking, you can't think of anything else, and it sort of gets a lot of momentum, and that sort of rumination that we call that, or thinking that the worst things are going to happen, and you can't sort of understand why those thoughts are happening. A lot of intrusive thoughts, angry behaviour and avoiding stuff. They're sort of the main anxiety symptoms. We also have other sort of diagnostic categories for anxiety. You can have a generalised anxiety disorder, and you may have had this well before you got pregnant or had the baby, but sometimes those experiences in going through a birth can trigger some of these a little bit more, or you can just get them for the first time. So generalised anxiety is really where you worry excessively about everything, and you can see from this chart there, you might worry about being in crowds, or your health anxiety might be a little bit more than most sort of people around you, or there could be obsessive compulsive disorder, and you may have also, we'll go into this a little bit later, but they are really sort of unwanted thoughts that make no sense and cause you to feel quite anxious, and in response to those thoughts you do behaviours to sort of settle the thoughts. You can have panic attacks. I think we've all heard of those, but some people think they're having a heart attack, where your heart can race, but often it's an anxiety response. Or specific phobias, whether you're worried about cleanliness of the baby, or vomiting. Sometimes people get this, or even pregnancy and birth. You can have phobias around that sort of thing, more specific to the perinatal period. Or PTSD, post-traumatic stress disorder, which can happen sometimes after a very significant birth trauma or other trauma. And that's quite different to perinatal depression and anxiety, really. And usually we hear about it when people return from war, but in fact it can happen here in your home if you're witnessing an experience or some sort of threat to your life that you perceive as threatening. So anxiety can take many forms. So when to sort of be concerned, I think when those thoughts or behaviours or feelings that you're getting are persistent, they're out of proportion with what maybe your friend or partner might be experiencing, a lot of body sensations, or it's impacting on relationships in your daily life, really, if you really can't function as you thought you were going to be able to. If it's interfering with your bonding with your pregnancy or baby, where it feels irrational or excessive and there's no logical reason for that. So sort of bring these sort of things to life a little bit more. We have Kathy on the panel, and she is going to talk to us about her experience. There she is with her little bub.
Hi, hi everyone.
Hi, Kathy. I'll leave it.
So much.
Hand over to you.
Okay, great. Thanks, Chris. Hello, everyone. I wish I could see your faces, but I'm sure I can probably imagine it or something. So I'm Kathy. I'm a Western Sydney mum. I live in the lovely Durra country and Dundas. And yeah, so I'm a mum of one. I've got a little 5-year-old boy who I'm actually homeschooling at the moment, but he's upstairs on his iPad. So the iPad's babysitting him at the moment. So yeah, I've only got one at the moment. And yeah, I've had several people ask me over the years, are you going to have another one? Are you going to have another one? You know what, when you have one and then you have another one, people are always going to ask. It's just one of those things. But the truth is that I did have a miscarriage a couple of years ago. So the reason why I mentioned that is because it exacerbated my anxiety and depression. But anyway, I just want to go back 5 years ago and what happened during that period. So, yeah, being a first-time mum is scary. So just to give you some background, my heritage is Vietnamese, but I was born here and raised here. So I've always felt like I was in this, between two worlds almost, like, you've got my strict Catholic Vietnamese parents who were just completely conservative, who arrived in Australia as refugees. And then you've also got my friends who grew up here, they were born here. And so I was just very accustomed to, the social norms, I would say, in the Western world. So, yeah, I always felt that I was kind of like caught in between. And, I kind of think back and, I really resented my cultural heritage a long time ago because I always felt like I was different. Obviously I looked different, but I didn't sound that different. So, but yeah, just sorry if I appear to be going around in circles. So yeah, when I had my son, it was just like the whole cultural norms and everything just suddenly exploded, and I just was not aware of all these nuances, and it was a very tough period for me to adjust. So not just adjusting to be a new mom, but also understanding the cultural expectations. So to give you an example, a common thing that a lot of ethnic communities do is, like, in the first month, the mother typically stays at home in confinement. So the idea is that, she's at home, she's looked after because, she's just gone through the birth. So her well-being and the well-being of the child is of most importance. But for me, given that I had a pre-existing condition of anxiety and depression, I had all these irrational thoughts. So I viewed the 1 month of confinement as a sense of control over me. So that's why I didn't want to do the confinement. And I actually made that clear to everyone, my parents and my in-laws, that I did not want to do that. But instead, the confinement came to me. So my mother-in-law, bless her heart, but back then I was just very ungrateful. She would come over every day to help out because it was her first grandson and she was so excited. For my mum, it was like the 7th grandchild. So it's not like she didn't care, but it was just more of, you know, Kathy is independent. She's always been independent and she likes things her way. I'll just leave her alone. And if she needs any help, she'll ask. So I loved that. But my mother-in-law was different. So she was just overbearing. Bless mother-in-laws. But for me at that time, I kind of laugh in a way, like when I think back. But back then, I was thinking that she was going to take my baby away from me, you know, and that's a clear sign, as Chris mentioned, of anxiety and all these irrational thoughts of, oh yeah, one day she'll take away my baby and my baby will love her more than me. Yeah, so I didn't want her to cook for my baby because I felt really threatened. I felt, oh, will the baby love her food more than mine? Oh, my food's not good enough, is it? And she just kept telling me to feed my baby formula, and I said no. So it just felt like this constant battle of saying, no, I don't want this, I don't want this. But I know deep down inside, she just wants the best for everyone. But in my mind at that time, it was just like she wants to take control over everything. And my husband, he didn't consult me beforehand, but he thought, oh, you know, since she's coming over every day, I'll just give her the keys to the house. And then so she would just turn up unannounced. And then so I just had this constant anxiety 24/7. Even in my sleep, in my bed, I would be like, she's going to come over tomorrow. And I just felt this overwhelm of, oh my God, I don't want to see her, but she's going to come over. What am I going to say? And so I just had these reoccurring thoughts in my head. And it just took over my life for many, many years. And so, yeah, so I urge anyone, you know, if you are feeling this way, this sense of overwhelm, you know, to seek help early on, because I left it way too late. I was just proud, you know, the independent woman who just wants to do everything her way, just to ask for help. But yes, my mother-in-law did help, but what I did not do well in the beginning was to create the boundaries. You know, it's hard when you've got an Asian, or in my perspective, my lived experience, you know, an Asian mother-in-law who just likes to take control over everything, you know. So I found, you know, pushing back really, really hard. I couldn't stand my ground because, you know, in my culture, you don't want to be disrespectful, especially to your mother-in-law. So, yeah, that's my story. Like, if you've got any questions, please pop it in the chat box and I'll try to answer it. But I think any sort of Asian mothers would completely relate to my story. It's just hard, you know, to ask for help, particularly, yeah, in our culture, we've been brought up not to show any emotion and not to ask for help, because asking for help is a sign of weakness. But, you know, asking for help is strength. So, yeah.
Kathy, thank you so much for that. It's so lovely for you to share. Kathy's one of our beautiful angels who shares her story to help other people and to sort of raise awareness of perinatal anxiety, depression. So thank you so much for that. There's lots of, it's sort of good to hear a story, isn't it? Because we hear all the theory and all the slides with all the information, but to sort of piece things together. So Kathy, you know, had a prior loss and felt like she left it too late. Although there are a lot of reasons why people leave it. You know, I think they do try and manage a lot on their own, you know, and try and be strong, like Kathy's saying. And there's cultural considerations and all of those thoughts. So I guess that get help as soon as you can is like one of the key messages, is sort of reach out. Don't feel worried, and anytime you are worried about anything that doesn't feel quite right is to reach out as soon as possible. So now we're going to talk about obsessive compulsive disorder, which can happen. It's not that common in the perinatal period, but it definitely can appear out of nowhere, or it can resurface if you've had this in your history before, and it's more than being super tidy. So it's got three main parts. You can have thoughts or images that keep coming into your mind, and they're called obsessions. It's like, I wonder if the window's locked, I wonder if the door is locked, I wonder if my baby's sleeping, I wonder if they're awake. Those sort of thoughts that come in at an amazing pace often. And there's a lot of anxiety around those thoughts. And they're really, really hard to settle once they sort of get momentum. So like I said before, then what people often do, and it is sort of like a coping mechanism in a way, is to develop compulsions or behaviours to reduce the anxiety. It can be quite debilitating and quite time consuming, and sometimes quite scary if you don't really understand what it is. It is very treatable, and once you sort of, there are strategies you can learn, and sometimes medications to sort of take the edge off a bit as well. So the sort of obsessions and thoughts, you can get a fear of contamination, germs, that sort of thing, or the fear that you forgot to do something, fearing loss of control, unwanted sexual thoughts too, which can be quite disturbing if you don't sort of put them in the context that it is about the OCD, and thoughts of harm occurring to you or someone else, or even you causing some harm. So there's sort of things to offset these fears. You might do excessive hand washing, you might get incredible eczema on your hands because of it, or you may not be able to sleep because you haven't checked the windows, 15, 20 times before you go to bed. You might do a lot of rereading of things, not sure, or a lot of tapping or counting before you're able to carry on with a certain part of your day. So all of those things can be pretty tough on people, and particularly women who have had that. And pregnancy can trigger the onset of that. So we do know, though, that even though you may have these thoughts, there is no research that you are going to carry out these thoughts. They are just thoughts. They can feel very real, but they're actually just thoughts, and they don't drive behaviour. So the best thing with that is to really get some support and understand them, and get them sort of sorted and managed as quickly as possible. So now we're going to talk about birth trauma. There's a lot of topics, aren't there? I hope you're finding this useful. Birth can be wonderful, but sometimes it's really frightening, and it can be physically damaging. And sometimes birth is nothing like you hoped or planned. And I think that's one of the biggest things, is that you can have a birth plan and have all these expectations, and sometimes it just doesn't work out that way. And that can be really hard to get your head around after you've had this baby. So not all of them go to plan. It can feel like your body has really failed you in some way, and a lot of shame and guilt around that, and a lot of disappointment. I guess the main thing is that we get this baby out as safely as possible, but 1 in 3 women experience their birth as traumatic in Australia. So that's quite a significant statistic, isn't it? And I think there can be not just physical injury, there's often emotional and psychological impacts of their experience of the trauma as well. So it's not just about what happened during the labour, it refers to how mums feel afterwards. And we also know that it can affect your birth partners as well. They might have a very different experience of the birth, but we know that they can also feel quite traumatised after, depending on what happens. It's a very subjective thing. Like, you will find 2 women might go through the same sort of birth, but they will have very different experiences of it, and the impact of it will be quite different. So it's a very personal thing as well. So after the birth, there can be emotional shock, guilt, numbness, anxiety, and at the time of the birth, there can be a lot of fear and helplessness. It can be maybe that the pain meds didn't kick in enough, or maybe your baby was, taken away and off to NICU very suddenly without explanation. There are a lot of things that sort of contribute to birth trauma. So I think the main thing is to be heard and to be able to tell your story. And I guess in counselling, you can do that. They certainly don't say that you have to tell all of your story to be healed, but there will be definitely things that you will want to go through and go over and sort of get some understanding and make some sense of it, and then deal with the sort of impact, whether it's physical or psychological or spiritually. It can affect you in lots of different ways. So if you sort of don't get treatment and it sort of stays with you and it's quite sort of moderate to severe in terms of the impact of it, it can develop into post-traumatic stress disorder. And one Australian study found that 1 in 20 mothers might show signs of PTSD 12 weeks after giving birth if it was considered traumatic. So again, the key message is to talk to your healthcare provider as soon as you can if you need some extra support around what happened. Now, postpartum psychosis is another perinatal diagnosis that can happen as well. It's about 1 to 2 in 1,000, I think. So again, it's not very common, but it can be quite scary. It pretty much means you're having lots of irrational thoughts, and you might even hear voices or hear people telling you to do things. It often means you can't care for your baby, and often means pretty immediate hospitalisation. It can happen with no experience previously of mental illness, or it can be exacerbated if you've had particular bipolar disorder or a strong history of it in your family, or a previous psychotic illness. It is all treatable, and often other people will notice, if not you, pretty quickly. The symptoms happen pretty much within a few days or weeks after childbirth. And you will have, confusion. You won't be able to make sense of things. You might be overly excited or irritable, sort of lose touch with reality. So sort of strange beliefs, bit of suspicion, and have some scary thoughts possibly about the baby. So it is treated as a medical emergency, and women pretty much make a full recovery, but you will find that it needs pretty immediate support. And now I'm going to go back to Katrina. Please keep the comments coming, and any questions about this stuff we can answer it at the end in the panel section for you. Now Katrina's going to talk about fathers and partners.
Awesome, thanks Chris. So up to 1 in 10 fathers will experience postnatal depression. So there's 4 key psychological factors or tasks that can influence a dad's transition into parenthood. So that's forming a bond with the growing unborn baby, adjustment to the couple, becoming a family, forming a concept of thyself as a parent, and wondering what type of parent I'll be and what type of parent do I want to be. We encourage dads to become involved in appointments with baby and to sign up to support groups like the Gidget Virtual Village for Dad or SMS for Dads to gain that extra support in this time. Being self-informed, doing some research about postnatal depression and anxiety is another way to move forward, and talking to friends and family or your GP. Okay, so it's important to seek treatment for mental health challenges or illness in the postnatal period for a number of reasons. So some unhealthy behaviours can be detrimental to your health. Sleep deprivation or disturbances are a barrier to your health, development and body repair. There can be some maladaptive behaviours such as self-harm or risk-taking, which can lead to some unintentional neglect to your children. I know neglect's a strong word, but it is unintentional as sometimes the anxiety or depressive symptoms can become consuming. Mental illness can create some disruption to bonding and attachment and reduce capacity to be attuned to baby's cues. So there's that it can also add to some unhelpful parenting styles and place an emotional burden onto baby and the partner. Impaired ability to tolerate distress can lead to a decompensation in your health, and poor outcomes with family function. There is also links to adverse childhood experience outcomes when a parent's experiencing severe mental illness. So treatment and management strategies. So there's many different modalities or types of treatment. It's great to have different ways of recovery because it opens up options for you to find a way that works for you. You may just gain inspiration from podcasts or reading things online. There's different apps that you can download and online networks as well. Some self-help programs are developed for conditions that are more mild to moderate that can be accessed online. And the type of treatment that's recommended for mental illness in the postnatal period is usually done with a risk and benefit assessment. So biological interventions include medication. So it's important to know that many medications are safe to use during breastfeeding, and later we'll have a slide which has the Mother Safe information on it, which is a service that provides best and safe practice guidelines for use of medication during breastfeeding. It's great to take a photo of that, take the number with you to your healthcare provider. And oops, sorry, I'll go back in my slide. Where am I? There. Yeah, take the number with you and make the call with your healthcare provider. Some psychological interventions, psychotherapy, cognitive behavioural therapy, dialectical behavioural therapy. Therapy can be structured or unstructured. Exercise is extremely important. Healing through the body is really powerful. Yoga is really good for the body, and getting outside and just going for a walk. And our babies, they love to go outside. It's a great opportunity. So social networking and peer support. So this might be through existing friends or making new friends through parenting groups, which Melissa will mention when she talks about child and family health. Or the Gidget Foundation's Facebook page. The Gidget Virtual Village is another great peer support networking place. So it's really important to ask for help. It's okay to ask for help. And if someone offers, to say yes. And I like to reflect on what Kathy said. These are not signs of weakness. These are signs of strengths and ways of coping, and that's okay. The concept of being a super mum or a super parent is about as common as Superman himself. Having realistic expectations on yourself is much more important. And have a think about what is self-care for you. What puts a smile on your face, and what activities lift your mood? Talk to your GP about what's happening for you. You can access a mental health care plan where Medicare will cover some of the psychologist's fees. Also on the slides coming up is a website on how to find a psychologist, or your GP might point you in the right direction. You can speak to your child and family health nurse about what's happening for you. The chances are the child and family health nurse has worked with other families with similar challenges. There's also some non-government organisations in the community that offer different levels of support. And in cases where treatment and management is no longer sustainable at home, a residential stay at a mother-baby unit may be helpful or necessary. Tresillian and Karitani offer short-stay residentials for more mild to moderate, and it's not just about sleep and settling. Your mental health is very much part of that bigger holistic picture, and referrals can be made just around adjustment to parenting and needing some support in that mental health space. And for more severe cases of mental illness, there's the mother-baby unit at Burwood, which is private. Unfortunately, it comes with private health cover or a large cost. But very excitedly that we do have 2 mother-baby units coming to the Sydney district over the coming 12 months. So watch this space. Just a little bit about sleep hygiene for self-care as well. Sleep hygiene is a term used to describe good sleep habits. Sleep hygiene looks a little bit different in the early parenting weeks or months. So know how sleep affects your well-being and accommodate this into your life. So for some people, a lack of sleep when baby comes along has a massive influence on their well-being, and other people can cope off very little sleep. When babies are born, they don't have a circadian rhythm yet, and most babies have a sleep pattern that we refer to as night and day confusion, where they sleep more during the day and less at night. So once again, a little bit cliched, but sleep whenever you can. The sleep hygiene typical patterns will come back into it as Bubby settles into some form of a rhythm. If also just important with sleep is trying to sleep in the hours of the later evening. So Lara might talk to this a little bit more in the panel, but just that you're more likely to obtain your best quality sleep in that stage, and it allows your body to repair, restore, and function more optimally if you could gain that best quality sleep in the later evening. It's related to underlying hormones. And in regards to infant sleep, if you'd like to learn more about that, we'll probably mention it in next week's infant emotional wellbeing webinar, or speak to your local child and family health nurse. So just a little bit about barriers to accessing support as well, and recognising, to be honest with yourself if you're struggling, and there's various reasons why people are reluctant to seek support. Stigma is one of the biggest worries. Biggest worries about speaking up, worried that you'd be viewed in a negative way because of your mental health. There may be a fear about becoming vulnerable, being in a position of becoming more hurt. Identifying yourself as being mentally unwell may affect how you perceive yourself and perpetuate self-depreciating talk. Personality traits can have an impact on one's capacity to help seek. And what comes to mind is being able to accept help in that place. The people around you may be dismissive or invalidating and even try to hide your unwell mental state. The cost of accessing some services might not be achievable for some people, and free services can have quite long waiting lists. A previously invalidating or unhelpful experience with a psychologist may prevent you from trying again in terms of accessing a psychologist. But finding a psychologist is like finding the right pair of shoes. Sometimes you just need to try a few before you get a comfortable fit. You may worry about discrimination against you, especially in relation to your career, and misconceptions around medication may limit your treatment options. Another large one is fear of child protection services. So most parents fear about speaking up about their mental health challenges because they actually worry about being seen as an unfit parent and risk having their children removed. But I can assure you that the Department of Communities and Justice, they are notified when there are specific risks to child safety, but the situation needs to be quite unstable for them to come involved. And even then, they aim to keep families together. So notice your barriers to speaking up and seeking support, and be curious. Ask yourself if this is a real barrier or a myth, and will I find a way forward if I challenge the barrier? If a friend of yours had a baby and is struggling, would you judge your friend as you judge yourself? Consider what you would say to your friend and tell this to yourself. If you are struggling, seek out a person in your life that you know will validate how you feel, or start with your GP or child and family health nurse. If you're worried about a loved one, ask them if they're okay. Let someone know that you're there for them if and when they are ready to talk. And we don't have to fix other people's struggles, just be there and listen. It's to listen and to validate is a really powerful means of support. There are many types of different mental illnesses in life, and mental illness is just one of these. It may be acute, it may be chronic, and there are treatments, and there is management, and there is recovery. And remember, you're a mum or a parent before a diagnosis. So now I'm going to hand over to Melissa from Child and Family, who will talk a little bit about child and family health nursing.
Thanks, Kat. Hi, everybody. So yes, asking for help is definitely a strength. Reach out and get help is a strength. We're in a child and family health nurses, they're in a privileged role to be hearing about people's experiences, birthing and early postnatal experiences in our engagement with families. So with the recent COVID restrictions, we're hearing more about more emotional distress when parents are sharing their experiences with the pandemic in general. So like, for examples, like in the birthing hospitals, you know, feeling isolated from friends and family who would have otherwise been able to visit them. Statements such as, I needed my mum as well as my partner. Reports of no control over the processes and choices were limited. Feeling overwhelmed and isolated, not being able to mingle with other mums in the postnatal ward, and not meeting other new mums in education sessions, which would have otherwise been provided on the ward. Another statement which has been common is guilty, asking partners to come in and staying longer so that they could just speak to somebody else, but also that guilt extending because the partner has to get back to their toddler who's being minded by the extended family. So it goes on. And then once at home, their feelings of isolation, no visitors on the normal, usual rituals after bringing the baby home because of the COVID restrictions, feeling totally overwhelmed. This was a first-time mum and not having an experience to compare to. Feeling overwhelmed and devastated. This was a multiple experience, so different from my previous experiences. Statements such as, we wanted my mum to come and support us as she did for our previous child. I needed my mum emotionally and physically. Feelings of being scared from my family overseas in contracting COVID-19. Feeling isolated from friends and family who would have been supporting us, bringing meals, helping with the toddler and doing some housework. So child and family health nurses are hearing you. We're hearing your experiences. So who are we and what can we do to help support you? We've been around for over 100 years, previously known as maybe a baby nurse, a clinic sister, early child health nurse, and now we're child and family health nurses. And that really encapsulates the whole family, and including the father. Our aim is to promote the development, well-being and safety of children and seek to support children and families reach their best outcomes. We support families through the early years of childhood, providing services to ensure optimal health outcomes for children and families. Our service is delivered in partnership with parents to provide health screening and surveillance, early identification of concerns and timely interventions. We help with sleep and settling support. We help with support with growth and development, child safety, how to play with your baby. It's amazing how many parents we hear say, I don't know how to play with my baby. Feeding support, immunisations, and very importantly, emotional health and well-being. Emotional well-being in the postnatal period is paramount, just like any other time in anyone's life, but we really focus on emotional well-being. We now have the evidence that our babies are phase scientists and require responsive, sensitive interactions for healthy outcomes. We can help support parents in that space. Child and family health nursing services work in partnership with parents and support referrals for emotional wellbeing and parenting support. So child and family health nursing services are available in all local health districts. And a link, I'm talking from Western Sydney perspective today, but there will be a link provided at the end of the presentation on how to access your local child and family health nursing service. In Western Sydney, all families with Medicare are offered child and family health nursing services provisions. During COVID-19 restrictions, our service provisions have continued with the provision of telehealth consultations. We're offering virtual parenting groups for all parents to connect with others and therefore reducing some of the social isolation we're experiencing. Hearing others' shared experiences, just like we hear with Kathy, health parents feel less isolated knowing others exist with similar stories. Social inclusion is a known mental health recovery domain, and so our virtual parenting groups can help facilitate that. Once the COVID-19 restrictions are eased, and we will return to our face-to-face parenting group provision. Other supports available for early parenting includes one-on-one breastfeeding support and sleep and settling information sessions. If you would like to access any of this support, you're welcome to contact your local child and family health nursing service. And for the Western Sydney LHD residents, you can call the 1800 600 681. Thank you.
Sorry, struggled to find my unmute again. Thanks, Mel. So just a little bit about the COVID vaccine during breastfeeding. So the current recommendation is that it's safe to have the Pfizer or Moderna vaccine whilst breastfeeding. Please speak to your health professional and let them know that you are breastfeeding. I think the slide after next has some evidence-based resources, some websites that you can find further information about, but there's no reason to cease breastfeeding whilst you have the vaccination during that period. There's no report showing that the COVID-19 virus is actually present in breast milk. In fact, the breast milk contains maternal antibodies from the vaccination that can help you protect your baby against the COVID virus. And breast milk is safe for most babies, and we'll support your choice to breastfeed or to formula feed either way. So yeah, here's this slide shows some websites. So take a photo if you'd like to do some more research around the COVID vaccine and breastfeeding. And now the following slides are also going to be more resources. So what I might do is flick through. So I'll show the slides whilst we invite the panel to respond to some of the questions or comments in the chat. If that's okay with you, panel.
So we've had quite a number of questions. I might start to address some of those and then pass to other members of the panel to address. In no specific order. Specifically, though, I do want to address a question that was raised regarding different parenting styles and the confusion that may cause, and that will be addressed in a lot more detail in next week's webinar. Sorry, can you guys hear me better now? Sorry about that. So with parenting styles, that will be addressed in a lot more detail in next week's webinar. But in response to that, and as it ties in very closely with the good enough parenting or being a good enough mother, you only ever need to get it right 30% of the time. The rest of the time where, there might be misattunement, rupture and repair of relationship between mum and baby or parent and child, that actually teaches a child that there are going to be those times when things won't go to plan, and problem solving is a very important skill that children learn early on. There are different maternal orientations and different styles of parenting, but there's a certain combination that is termed authoritative as opposed to authoritarian that tends to come out with best possible outcomes, and that includes things like being able to limit set but still being flexible, negotiating and providing reassurance, so being warm and supportive to the child, but also being able to set limits and being able to assert yourself as parent and therefore boss in many ways, which means that there is a place for child to have their say, and often children who feel safe and secure within their attachments are able to voice their issues and able to voice their concerns. Next one I'm going to go on to, and please feel free to raise questions, is clarifying whether there is evidence that can be passed through breast milk. COVID cannot be passed through the breast milk. The virus doesn't enter the breast milk, but you can pass it through your baby virus respiratory droplets. And that's why we say there is no one correct way to do anything, and we encourage taking the proper precautions. So that's masking, washing hands. If you do have the virus, you might choose to express and feed so that it's not so close. But, you know, again, if you choose to breastfeed, we just encourage the respiratory hygiene precautions, droplet precautions, those sorts of things. Yes, antibodies go through the breast milk, and antibodies are protective. They actually do impart a certain degree of immunity for the baby. And of course, at that early stage, a neonate doesn't have the vaccinations yet, and their immune system hasn't developed yet. So in other words, you're really giving them some protection against viruses and infections of all kinds, not just COVID. There were some questions about how to assist families or women with postnatal mental health concerns in accessing support. And yes, some women are quite hesitant. I think the way that I would encourage clinicians to address this is by gentle encouragement, in very much the same way that we approach anything where there is hesitancy on the part of the person who needs help. That's of course unless that you're foreseeing some imminent risks. So if there is imminent risk, then of course action needs to be taken, and that's irrespective of whether you've got consent or not. But if it doesn't present in that way, I think gentle and repeated encouragement, along with validation of the issues that are concerning them. So, for example, if it's a cultural based hesitancy, then to acknowledge that, validate it. And at times it may be helpful to encourage the mum that you're concerned about to invite a family member or a partner into a consultation, whereby some of these issues can be destigmatized. There are also hesitancies because of fears of all sorts, including child protection, for example, and things like that. So sometimes just clarifying the roles and clarifying when, these concerns arise, what steps can be taken and how things can be addressed in a very delicate way is really important, and can put a lot of these stresses to bed. It may not happen on the first consultation, but with persistence, I think it gets easier. A lot of the professionals that we do have attending today will work within networks, and in your network you should be able to access some subspecialty advice as well. So if you do feel stuck and you've got a mum who you think could really benefit from some help but don't know how to approach it, or are just getting a lot of barriers, reach out. I know that in Western Sydney, so at Westmead, we do have perinatal CL and we have PIMS, Gidget Foundation's there, as well as a whole load of other professional entities, NGOs and others that are able to provide some advice. So we're always happy to receive those calls. So there were some questions regarding, not questions, but a comment regarding postnatal anxiety and panic. And thank you for the lovely professional who brought this one up. If you do require additional support, please do reach out. But it's very helpful to know sometimes where that's coming from, and discussing it openly with the individual is very important. destigmatizes it, but it also lets them know that they're not alone. There were a couple of comments on birth trauma, and trauma is in the eye of the beholder. So trauma doesn't have to be physical. There doesn't have to be a massive postpartum hemorrhage or some, terrible kind of physical issue that's happened. It could be that a mother is feeling disempowered during the labour and birthing process. Maybe she wasn't able to voice her concerns during the process. And if that's, what a mother has experienced, then it's a birth trauma. And it does need to be approached with a great deal of delicacy and dealt with, because if not addressed, it can cause a lot of issues to come to the surface at a future pregnancy or delivery. It could also have implications on mum's vulnerability to developing a postnatal depression, postnatal anxiety, etc. And of course, with ramifications on the parent-child attachment. Now, I noticed that we are going beyond our hour, and there were some thoughts on whether to speak more to sleep and anxiety. What are your thoughts, Katrina and Melissa and Chris, about that?
Yeah, look, I'm happy for you just to talk a little bit more about the importance of sleep and what happens in the early postpartum period. It affects us all at that time. And if people do start to leave, that's perfectly okay. We have gone over time. I just wanted to say a big thank you to the panel for being here and contributing to the the webinar, and a massive thank you to Kathy. Like, I'm so appreciative of you sharing your story. Like, you're amazing and you're such a strong woman, and thank you, really appreciate it. So, and in regards to the recording and the this webinar being available, I do plan to cut out the little bit at the beginning where we're just waiting, and then hopefully make it available on Gidget's YouTube site, and then we can share the link to that. So so all those registered, that's the plan to share. So Lara, I'll hand back to you just to talk about sleep, and we can finish up.
Thank you, Katrina. So with regards to sleep, I mean, we've touched on it, but the importance of sleep, particularly from a maternal repair perspective, is just, it's so vital. And there's going to be this constant push and pull, because of course your baby hasn't developed that sleep-wake rhythm that allows you to sleep through the night. So let's say sleeping through the night might be off the table. And in that case, kind of capturing those periods of time when baby is asleep is very important, particularly in the earlier part of the night, that evening to midnight. If you're able to get even a couple of hours of sleep during then, it's a time when your body's stress hormones are able to go down to twilight levels, and therefore your body can repair. It's also the time when your body is able to excrete a lot of melatonin, so the sleep hormone, and so you get that better quality sleep in that first part of the night. Once you're kind of into the very early hours of the morning, the 2 a.m.s and 3 a.m.s, the period of time that you can stay in a very refreshing and deep sleep becomes shorter. And that's because your stress hormones start to rise again, just in response to the natural cycle. And that's why we kind of emphasize this earlier part of the night. If you can get a couple of hours, if you can get a good stretch, even better. but then that sets you up to kind of be in the best possible position to be able to, you know, keep on keeping on. Of course, without that kind of refreshing or restorative sleep, what ends up happening is your body is lacking that opportunity to repair. Also, your mind is lacking that opportunity to reset and to process a lot of things as well. So it does increase the risk of postnatal mental health issues, you know, that lack of feeling of well-being, etc. But, you know, different babies are different, and certainly if your child has an underlying, say, medical issue, it may really kind of abolish any opportunity to get that nighttime sleep. And that's when we start encouraging, you know, people to try and get that extra support for night feeds and night awakenings. So partners, you know, getting ready to take on some of that load as well, if that means expressing or bottle feeding or whatever it is. We usually really advocate for that. And on that note, we really encourage mums to do, and mums and dads and families to do what's best for you. It doesn't need to be one way or the other, but if you find something, a way that works for you, go ahead. We support it. I'll hand back over to you now, Katrina.
Thank you. Melissa or Chris, did you have anything else to add? Or Kathy?
Not from me. I think Lara's answered those questions beautifully.
Yeah.
Thank you too, Kathy.
Thanks, everyone.
All right, well, thank you, everyone. So next week we have infant mental health webinar. What is infant mental health? Do infants have mental health? So we'll spend about an hour talking about that, and hopefully we'll see you there as well. And thanks for the time today.